Well, good evening, everyone. My name is Aisha Barnes. I'm the Senior Manager for Alumni Relations at Chamberlain University, and welcome to our Commit to Care webinar series. We've started this series to have our Chamberlain alumni give firsthand perspective on what it's really like to step forward towards a rewarding career in nursing. As many of you know, nurses are needed now more than ever. And for those with a calling to serve like yourself, there has never been a better time to pursue a career in healthcare. The format of this event tonight is super informal. So we are in a Zoom meeting format, which means you have the ability to control your camera and your sound. So if you want us to see your wonderful face, you're more than welcome to turn your camera on. The only thing that we ask is that you remain muted if you're not speaking or answering or asking a question, so we don't have too much disruption when our panelists are giving their responses. Tonight, we have several of our wonderful Chamberlain alumni here to share with you, and I will go ahead and let them introduce themselves. First, we have Alicia Arnold. Alicia, come on and tell us a little bit about yourself.
It's funny because my name says Arnold, but I actually just got married and it's Alan now. And I didn't even
congratulations. Well, you have to change that now. Oh, yeah, I'm sure your husband, you got to change it.
I didn't realize it until just now. I'm like, Alicia Arnold, what? So I went to Chamberlain, Columbus campus. I graduated from there in 2016. I currently work in IR, which is interventional radiology. I have background also in cervical ICU as well.
Awesome. Thank you. And then we have Alyssa Luptech. I hope I said your last name correct.
Good job. Yes. Hi, guys. My name is Alyssa. I graduated the RN BSN program from Chamberlain in the Addison campus in Illinois in 2014. And then I graduated the FNP program from there, the virtual online mostly, a couple of years, 2 years ago, 2019. So I've been working as that for a little bit, but a good amount of nursing experience. I worked ER, labor and delivery, acute care, short-term rehab. So got a little taste of a lot of different things, but which is the great thing about nursing. You get bored of one thing, you do something else.
That's right. That's right. Variety is truly the spice of nursing, right? Not just the spice of life. And I just want to make sure, we were supposed to have one more. I want to make sure because there are some people who don't have their names. Is Boney on the line? If not, it's okay. We've got two wonderful alumni that will be sharing this evening. Okay, well, Alyssa, since you're in the spotlight, I will start with you. Tell us, how did you know that nursing was the right profession for you?
Well, I tried like 20 other different majors before. I was like, I'm gonna be a teacher. I'm gonna be in business. I'm like, you know what? I'm really into healthcare. I was really good at anatomy. Like, I love that kind of stuff. And I'm like, I've heard, I talk to people that are nursing. I'm like, this sounds like it's for me. I'm like, my dad's like, I'm not paying for medical school because I was kind of lazy in high school where I would just memorize things and pass all my tests and not learn anything. I could just photographic memory. But then, things changed when I finally got mature and got into nursing school because it took me forever to figure out that's what I wanted to do. But so that was kind of my path, was like going back and forth. And, a lot of people actually that were in my class had different majors before and then came to be nurses, and they had like kids and stuff for going through the program. So there's a lot of people in different stages of their life there. So I always thought that was so interesting, but there's never a wrong time to start nursing school because there's just so much, like you said before, you can do with it. So
right. No, that's true. There's never a wrong time at all. It's all about what the right time for you, right?
mm-hmm. Yep.
What about you, Felicia? How did you know that nursing was the right profession for you?
I actually have a similar background like Alyssa. I had several other majors before. I actually have another degree in psychology, which I wasn't able to do anything with because I graduated with psychology, tried to get a job, and realized there was nothing I could do with a bachelor's in psychology. I ended up during that time finding a job as like a nurse assistant kind of thing in a rehab for traumatic brain injury and spinal cord injury patients. And I knew nothing about nursing going into this job. It was really, I was just trying to get a job at the time. And then I got into the flow of, I was in charge of giving them medications and helping them with baths and feeding them and all these types of things. And I was like, oh, I really actually like this and I can make a career out of this. And so that's what actually got me started in my career in nursing. And that was back in 2010. And then I was a nurse assistant for a while before I actually started the nursing program.
Wow. Wow. So you also did a career shift. I love that,
Yeah.
You don't have to like start immediately or know immediately. Like you said, you were
Right.
in psychology. You're like, I don't know if I can really use this
Pretty
degree how I
much.
really want to. And you took a
Right.
job that was related to nursing, and then that led you to nursing. So that's amazing.
Yep.
Awesome. So let's stay with you, Felicia. What does it look like to be a nurse?
That is a very interesting question because I think my perspective in nursing school is very different than now. I think back then you felt like it was always just going to be this great thing, and your patients are always going to be wonderful, and you're always there to save the day. But it looks a little bit different. You kind of realize you have multiple jobs. Like you're not only the nurse, you are the coordinating team of your patient. You are security sometimes. You can be the janitor sometimes. There's a lot of aspects to being a nurse, but I think I don't want to get away from, yes, you still have to have compassion. You still have to, be there for your patients in their very vulnerable times. So it looks like a lot of things, but I think you have to go into it with an open mind.
Definitely. Like you say, you are truly a jack of all trades.
Yeah.
And you didn't know that until you got into it. You were like, I'm going to save people's lives. And you are
Yes.
doing that,
Right.
but you're doing so much more in addition to that too.
Yes, exactly.
Alyssa, same question. What does being a nurse look like in your opinion?
Lots of chaos, lots of caffeine. No, it's Felicia was saying, you wear a lot of hats, but it's awesome because you learn so much. You do things from so many different aspects, and depending on what kind of job you do, like obviously the ER, you're saving lives, but then you're also, like I said, playing security, and then you also have very sad moments, you have very happy moments. Same thing, labor and delivery. I was like, this is all happy with babies, and it's definitely not. So, you learn, if you were never kind of an emotional person, like how to deal with patients from that level, as well as, so you're not only just taking care of people, you're taking care of their whole self, their emotions, there's a lot of different things that go into it that you'll definitely pick up on in clinicals and in school, like doing the bedside thing. But it's a learning curve. You're always learning, and it's a great thing if that's kind of person you are, because this is what you're going to be doing, nonstop learning, figuring things out, advocating for your patients, saving doctors' butts, and yeah, a lot of that. But yeah, it's a really cool job because, like you said, there's just endless opportunities for growth.
That's awesome. Wonderful. Constantly growing. I think that's how we know that we're alive, right? That we're learning something new every day. But it's amazing in nursing that, like you said, you're constantly growing, constantly learning. It doesn't just stop once school is finished. So no, that's awesome. My next question, you guys already kind of answered. So I'm going to throw a little bit of a loop in there. Because the next question was, what do nurses really do? And I think you guys did a great job of kind of describing that. But I would wonder, how do you think that Chamberlain kind of prepared you for your career? Let's talk a little bit about your Chamberlain experience and how that truly prepared you for your role as a nurse. And Alyssa, you can go ahead.
Okay. Chamberlain was great. I really, as scary as nursing is and seems, when I got into the world, I felt like very prepared. And you guys like in that now, because I'm teaching there too, you have so many more tools and simulations and like it's even fancier now. So, there's nothing is going to prepare you for every situation that's impossible, but Chamberlain gives you a very good base of knowledge and skill sets and what is important, and you get to practice some things, and there's a lot of things that you don't, but whenever you're allowed to do something hands-on, do it, because might be some of the times you're going to have guidance with the nurse or your teacher. But I definitely got a really good base from there. So it was a little bit less scary going into the real world. Because, if you go into a nursing job and you're not scared, then that means you really don't care. And that's what I learned. That was the first thing they told me in labor and delivery. And I'm like, interesting. And I see that about every job now, because it's definitely true from this aspect, from the caring aspect and all that. So
Oh, that's wonderful. That's good that you have that good base. But you're right. If you don't have any feelings, then do you really care about the job that you're doing? Because you're dealing with people. You're not dealing with widgets or other things. These are truly human lives that you're affecting. What about you, Felicia?
I would probably go back to the sim lab. Sim lab could be scary because you have the teachers kind of behind like this glass that you can't see, and there's real life scenarios, and you're kind of working through talking to a mannequin. It's not real, but those are the times that you get to mess up. You get to mess up in sim lab. You get to say the wrong things, you get to give the wrong doses and be corrected. And so I think having that at Chamberlain was probably the best part that prepared me as a nurse, because it gave me the opportunity to make the big mistakes. Like, you're still going to make mistakes as a nurse, like, let's just be real about that. But nursing school teaches you how to be a safe nurse. And so that's what I appreciate about Chamberlain.
Awesome. How to be a safe nurse. That's
I
great.
just taught the sim lab for the first time. The sim, I got to teach and be on the other side of the glass, and that was really cool to see. Because like you were saying, it was always a scary, weird situation. But like you learn a lot, and you can't kill anyone, so it's an amazing experience. And you take a lot from what you learn there, and get your nerves out. But it's really cool.
It's good. That's wonderful. Felicia, tell us what's the best part of your job.
I would say the best part of my job, let's just be real, is the schedule. Going back, I worked in the ICU. I worked 12 hours. I worked night shift, often did overtime, and it beat me up. And so now I've transitioned. I work days. I work all weekdays. I do not work weekends. I should not say that. I work every 7th weekend on call. So I'm not going to work unless they call me. And then I work one holiday a year. So that is a very, very good plus about my job. The other good thing is I have variety in my job. I work in so in radiology, you work in CT scan and do biopsies. And then you can work in ultrasound, and you can do paracentesis and thoracentesis and biopsies as well. And then I could work in interventional radiology, where we do a number of things, retrieving pulmonary embolisms, cauterizing bleeding, internal bleeding or whatever. And then where else do I work? There's one more I'm missing. I also work in MRI as well, which is like a piece of cake, because again, like today, a patient was getting an MRI, and they had a pacemaker and defibrillator. And to go into an MRI, they have to be put into a safe mode, basically. And so I have to monitor them during that time. And so I'm basically just there to watch the monitor. And so that's like my easy day. So I get a variety of things. Like, I still have the ability to use my ICU skills. I still use my critical thinking, because during like biopsies and embolizations, things like that, I have to give conscious sedation. And so it can get a little intense, but I like that I have the intensity, and then I have the very chill. Like, I have a nice variety.
Right. No, that's good. That's good. What about you, Alyssa? What's the best part about your job?
Ooh, there's a Starbucks there. No, I'm just kidding. Back to the cafe. Well, going back to my ER job, that was my most recent nursing job. You know, it's just the everyday, like I'm a kind of person who likes variety, which is why I keep saying that, but it's like every day is different. But you can go to a job where you do a lot of the same stuff. So it depends on what you like. You can go to a job with a beautiful schedule where you don't work holidays, or you can work night shift while you're young, like I did, make a ton of money, burn out in 3 years, and then reset and do day shift, unless you're a night person. So that part's really cool. But like, you know, just I would say like just the feeling of, you know, you like running a code, like, you know, maybe you'll never do that in your life, but at least seeing one, or like the just the teamwork, the fluidity, like just seeing how everyone works together so well as a team to come together for the best interest of the patient, I just thought was just amazing. And yeah, you know, like just seeing everyone come together. You know, if someone lacks knowledge in one area, you got somebody else that's going to help you. You always have a mentor, you always have a guide, you always have Dr. Google, you always have, you know, so like you got all these little gadgets in your back pocket. And, you know, and if you make mistakes and you're resilient, you're going to learn from them. And hopefully, like you said, you know, in sim lab, it's not a big deal, but, you know, you learn not to make those and how to prevent stuff like that. So I think it's just really cool. Like, just the flow of everything, and anywhere you go it's different. Same thing with like labor and delivery, any emergency, you know, everyone's running, you have a whole team in there, you see the baby's heart decelerate down and there's 3 other nurses in your room in like 5 seconds. You're like, cool, I don't even need to call you, this is amazing, thank you. So it's like, you know, just the bond, the teamwork and patience. You know, you may have a patient that you can't stand, but you know in your heart if something bad happens to that patient, you'll be the first one there trying to do the best that you can care for this patient. So you know, you're not gonna like everyone, so just remember that. But you have a good heart because you're gonna be a nurse. So you're gonna always do it, you're always gonna learn. So I just like that, you know, continue teamwork, the learning. It's awesome.
Wonderful. I'm going to throw another curveball question at you all. It was because Alyssa, you talked about resilience. So this concept of resilience and self-care is super important now, especially as we've dealt with the pandemic and all the stress related to that. What were some of the techniques that you had while you were in school, but also maybe you carried over now that you are practicing as a nurse? What were some of the tools and techniques you had for self-care and resilience? What did you do, and how do you continue some of those practices today?
We want to go
Um,
Go
I'll
ahead.
go.
Go ahead.
Go.
Okay. So I would say having your friends, having your tribe, your nurse friends, because like I would come home and, you know, I could talk to my husband, but he'll be like, yeah, okay. Like he won't understand anything that I'm talking about or understand why I may feel the way that I feel. So it's nice to have my nurse friends that I can talk to and kind of just release with, because we all kind of go through the same things. The other thing is like, it might sound bad, but leaving work at work, um,
Mm-hmm.
you know, knowing to step away. And when you're at home, just like being present at home, taking care of yourself, whatever that may look like for you, working out, taking a walk or hanging out with a friend, or, you know, whatever it looks like you have to get away from work.
Awesome. Excellent. What about you, Alyssa?
Yeah, I tell my students that too at the end of the semester. I was always like, you know, you still come first. Like you gotta take care of your patients, but self-care and your family, you gotta make sure your priorities are always straight. And I'm not saying to slack off at work, but just remember that however you gotta take care of yourself, take time for yourself. Don't always stress and think about work when you go home. No, just relax. You know, sit on the couch, play with your kids, whatever you gotta do. Pet your dog, just leave it there. Once in a while, you can tell if there's a really bad story because you're gonna want to. That's fine. You can still share. You don't have to not tell every story, but they're not gonna understand it on levels that you do necessarily unless they're in the medical field. But two huge things also that Chamberlain kind of forced me to do was time management and being organized, because you just have so much to do, and those carried with me through helping me prioritize, helping, you know, while I was so busy because the ER, you run around like a maniac a lot of the time. So I think those are two really big skills that I got from there. And even if I didn't want to, you guys kind of forced me to do it. So, which is good because you need that. I mean, you need to stay organized. And even like when I taught fundamentals, a lot of the students are still kind of trying to learn their ways to do it. So definitely, figure out what works for you, because that's going to help get you through this, and then carry on your good habits when you become a nurse, because you're going to have a lot going on.
Awesome. No, that's great. Last question before we open up to the audience, and I see a couple questions in the chat, but last question for you two before we transition to those. What is that one piece of advice that you would give to someone who's considering a career in nursing? And it could be two. You might have two pieces of advice, but what would be that advice that you would give someone?
I would probably say maybe to go in with an open mind. Again, like nursing for me was not what I thought it would be going in, but it doesn't mean that it was all bad. But I also had an open mind and was accepting the career that I was in. And so also one thing I'm like hearing it. So sorry. So also one thing is lost my train of thought. Yeah, go ahead.
Yeah, that's definitely, open mind is good. I would say, because it's different. Definitely when you get on your own, it's a lot different. It's okay to cry. It's healthy. If you take a scary job and you're a new grad, let it out, because then you bottle it up. Just let it out. But not in front of people. Not in front of patients. But don't forget, that's good for you. But definitely, like, biggest piece of advice I have is just enjoy it. Enjoy it. If it's something that's driving you crazy, you're not happy, try to find the positive in it. Am I learning something? Because it's not all going to be positive, but if you look at it from the best situation, and can I learn from this? What can I do? Then, kind of like you're saying, with open mind, you're going to just keep growing, and you're going to love what you do, and you're going to figure out what you really want to do, and then you'll really enjoy nursing.
Wonderful. Awesome. Well, we've got a couple questions in the chat. Some of them are super specific, so I don't know if you guys can answer, but I know we've got a few other guests. Lee, I know you're in the audience. So I'll ask some of these, and if we don't, we'll take them back and we'll get an answer for you. So one person asked about, could they have some tips to crack the Hesi A2 exam with no science background? And Alyssa, you smiled, so I'm thinking you know what they're asking.
Well, the Hesi. I did great in school, and I like messed that up. So I'm laughing. But the same thing with when you are going to pass your boards. If you study good in school, you know the stuff. So what I say is just do practice questions. Practice, because you need to know how to answer the questions. Like, you already know it. If you studied really bad, then you got a lot of work to do. I can't help you there. But if you did the work in school, you studied like you should, you got decent grades, then you just practice the questions so you know how to answer them, because remember, there's always two right answers, but only one of them is gonna get you the points. So you gotta know which one is more right. So figure out, crack the code. That's why you just keep practicing.
Felicia, I see you nodding your head. You agree?
I do agree. Yeah.
Awesome.
And it's just funny that she's like, there's more than one right answer. I'm like, that's all of nursing school and the NCLEX. So
more than one right one, but you got to know the one that gets you the points. That's a good quote. I like that.
Yeah. Just kidding.
Michelle, you asked about program requirements. If you want to put in the chat or maybe unmute yourself, do you have a specific question about program requirements? I'm not really sure. Someone asked what Hesi exam book is used.
I don't know that one.
I don't know. And then the time frame doesn't need to be taken. And then someone said that they're using, Naya says she's using Hesi A2 Secrets, one by Trivium, both off Amazon, and then the Hesi admission assessment. Okay, this Hesi is giving people.
Right. So is that you guys have it for admissions? Is that?
It must be.
The thing
Lee.
change. No, yeah, I'm not sure. I just want to make sure that's what.
Yes.
Well, if
Had to
it's
take that
admission,
before getting
then
in.
you just, wing it. Just kidding. I mean, you're not expected to know all this stuff by now, so I think I don't know what the questions would be on those. So maybe I shouldn't answer.
No, it's okay. I'm gonna ask Lee, I don't know if you know the answers.
I can answer these questions.
Okay,
So
perfect.
I just, for everyone that's joining us, and I would just like to say thank you so much to the alumni panel that has joined us today. You guys are doing fantastic. I'm really enjoying hearing your stories as well. Regarding the Hesi test, so all nursing colleges do require an entrance exam. It's usually the T's or the Hesi. So Chamberlain University, we do require all students to take the T's or the Hesi. So Chamberlain University, we do admissions require all students. I do apologize if you hear a little bit of that, but what I wanted to let everyone know is part of the admissions process for all students who are interested in is to actually speak with an admissions advisor to review all of your prior college history or even your academic history, and then to kind of look at that and assess where you are. So one of the things we do require is just to make sure that you connect with one of us so we can go through those individual questions. Everybody has a different entry point, and the Hesi test examination book does change from year over year. So the alumni panel, we have the book that they may have used for that resource. Well, it's at least a couple years later, right? So that might be a different resource as well. Moving forward, we do have different things that are for potential applicants in order to be hosted by some of our proctors for that. So if anyone is really concerned as far as the Hesi assessment, my name is Lee Bell. I'm the director of admissions for most of the Texas campuses. So you can reach out to us as well. But the T's is another test, and it is not the same as the Hesi per se. The format is a little different, but most entrance tests do cover wanting to make sure different sections at a entry level college area. So for example, if you'd attended a college before, and let's say you took anatomy and physiology and you did really well, I probably wouldn't have some anxiety about that Hesi assessment. So the Hesi for Chamberlain, all students have to take all 7 sections of the Hesi. So that's the reading comprehension, vocabulary, and then of course a learning style, behavioral exam, as well as A&P, chemistry, algebra, and biology. So students, it is a requirement, and I would just say this, don't let one exam stop you from pursuing what you want to take, because guess what? Just in order to be an RN, you've got to take that NCLEX. So taking an assessment to get into the nursing career is just standard. I hope that answers everyone's questions about that.
I think so. Yeah, that seemed to, all the ones I looked through in the chat, it seemed to. Thank you so much for that, Lee. I'm so glad you're here.
You're welcome. No problem.
Awesome. And if you all have specific questions, Lee, while you're still unmuted, can you give the number for admissions so someone can definitely walk you through the prerequisites, what you have, what you'll need. They can have that conversation with you, correct?
Correct. There's a couple different things you can do. What I always suggest is if there's a specific campus location that you would like to get information about, just to go to the Chamberlain website. It's right there. You can just put Google and Chamberlain University, and then our webpage will pop up and you can pick your specific campus location. And on there, there's a chat feature where you can access if you're wanting to learn more information, where you can get questions answered right away. And the ones that team can't answer, they will automatically route that to an advisor to follow up with you, so it can be tailored to your individual needs.
Wonderful. Thank you so much. Were there any other questions for our alumni panel or for Lee?
Hi, my name is Sarah Gonzalez. I have a quick question for you guys. So at what point, when you're deciding on switching between like labor and delivery or ICU, what makes you make that decision to make the switch? Is it a burnout? Is it something that you just want to try something new? Or is it like passion?
it could be actually all of those things, or just one of those things. So for me, it was more, I was burnt out, working night shifts and being on your feet all day. It was really hard on my back. It was really hard mentally. And so I transitioned out of the ICU for that reason. But I have colleagues who actually went to work into the ICU because they wanted to go to CRNA school. And so it was more of a career move for them. And then I've known some people to leave a job because of their family life. Like they needed something more like a clinic type of setting, daytime hours, because they have a family now or something like that. So it's all different reasons.
Yeah, schedules is a lot to do with it because like my one friend has to keep working night shift, so because that's just what works for their family. But like my journey in itself was like I was working in acute care long-term rehab. I didn't want to do it. I was just getting my foot in the door, and I cried almost every day because I had 30 patients, and it was like the toughest job ever. That, and I'm a tough cookie. But so I just wanted out, and my cousin actually helped me get labor and delivery, which I didn't know that I'd be really that interested in. Like I loved it in clinical, but I was like, yeah, I'm gonna be a NICU nurse. But labor, ended up loving it. I was like, this is like the ER of OB, because I always also wanted to be an ER nurse. So I went that route, did that for a couple of years. I did the night shift, and then I was just kind of burning out for night shifts because it was 12-hour shifts, and I'm a very routine person. So like it was just a lot for me. And I was back in MP school, and I was like, now's the time to try for my ER job. Like I need the experience because I'm not like specializing in women's health. So, I got my day shift, so I wanted the schedule. And I worked full-time days until I started clinicals and I had a baby, and then I actually got to switch to resource. So I basically worked whenever I want, which is amazing. And I made more, which I don't know, that makes sense, but I lost insurance, but it's trade-offs. So, there's many different reasons that you can switch, but like, if you know in the back of your mind what you want to do, and you're kind of like, maybe I should try it. You can always go back. Like I would love to go back to labor and delivery. But right now, my cousin's in where I used to work, and there's been a lot of really acute, like sick patients with everything going on. I don't know if it has attributed a lot to COVID and stuff going on, but so it's been a little bit sadder and crazier than it normally is too. But yeah, so it's just kind of, you just balance everything out, and then you just kind of know at one point it's the right time, because of one thing or another. So
Thank you.
Great question, Sarah. Thank you. Any other questions? Well, awesome. With that, we'll wrap up. We're pretty much at time. We expected this to last about 30 minutes. I want to thank Alyssa and Felicia for providing their firsthand perspectives. I hope they've helped all of you who've attended today. As Lee said, definitely if you have any questions, if you're looking to attend a Chamberlain campus, go to the Chamberlain website, select the campus of your choosing, and get the information, and reach out, and someone will work with you to answer any specific questions related to your academic background, and the curriculum and the Hesi and the T's. I learned some things tonight about Hesi and T's. So now I'm happy. But they will definitely, we're here to assist you throughout this entire educational journey. So we're more than willing to answer all those specific questions related to you and what you need to progress. And so with that, I will bid you all good night. Again, thank you. We're having 2 more of these sessions. So if you know of anyone who wants to attend, have them register. We're having one next Thursday, the 17th, and another one on June 24th at the same time. Thank you so much, and have a wonderful evening. Good night.
Good
Bye,
luck.
everyone. Thank you.